Bismillahirrahmanirrahim. Quote of the day: and be patient, for indeed Allah does not allow to be lost the reward of those who do good. Today the topic of presentation is primary healthcare planning. I am Dr. Iqbal, PGR Community Medicine, and I am presenting under the supervision of Professor Dr. Saira Afzal, Dean, Institute of Public Health. Learning objectives. Today the topic of learning objectives of primary healthcare planning, objective of primary healthcare planning, cycle of primary healthcare planning, challenges in PHC planning, universal health coverage versus primary health care, role of AI in primary care, and MCQs. Learning outcomes. At the end of this presentation, participant will be able to understand primary health care planning, objective of PHC planning, cycle of PHC planning, challenges in PHC planning, universal health coverage versus PHC plan, role of AI in PHC. Primary health planning. Primary health planning is systematic, evidence-based, and participatory process of identifying community health need, setting priorities, allocating resources, implementing intervention, and evaluating outcome at primary level of care to achieve equity, effectiveness, efficiency, and universal health coverage. PHC planning focus on preventive, curative, and rehabilitative service with strong community involvement and intersectoral coordination. Next, objective of PHC planning. Objective of PHC planning are to improve accessibility and equity of health service, addressing priority health problem of community, optimize use of limited resources, strengthen preventive and promotive service, reduce morbidity and mortality, especially among vulnerable groups, ensure community participation and ownership, support achievement of UHC and SDGs. Next is principle guiding of PHC planning. PHC planning is guided by following principle: equity, efficiency, effectiveness, community participation, intersectoral coordination, appropriate technology, and decentralization. Level of PHC planning. These are the level where the PHC planning carried out. First is national level, where the policy formulation take place, set standards and financing. Provision level or the state level, adaptation and resource allocation. District level, operational planning and implementation. And community level, where micro planning and service delivery. The district is considered the most effective unit of PHC planning. Next is cycle of PHC planning. First of all, we analyze the situation and then set our priorities and see our goals and objective and formulate strategy. Then we allocate the resources and implementation, and then monitoring and evaluation. Now we'll discuss this step by step. Step one is situation analysis. To see where are we now. It involved demographic profile, population size, age, sex, epidemiological data to see disease burden trend, health service coverage like MCH, API, FP, health resources to see staff, facilities, fund, community participation, and health seeking behavior. Purpose of situation analysis is to identify existing health problem and gaps in services. Step two is priority setting. Since resources are very limited in our country, prioritization is very essential. Method which are used is burden of disease analysis, cost effectiveness analysis, equity based prioritization, community based prioritization. Step three, uh, goals and objectives formulation. Goals are very broad and long term. For example, reduce maternal mortality, infant mortality. Objective should be SMART, which is specific, measurable, achievable, relevant, and time bound. Step four, strategy development. How objective will be achieved, such as strengthening the BHUs and RHCs, training lady health workers, community mobilization, outreach services, and referral strengthening. Step 5 is resource allocation. Efficient allocation of resources like human resources, doctor, nurses, LSWs, financial resources, infrastructure and equipment, medicine and supplies. Step 6 is implementation. At this stage, planned activity are put into action, which include service delivery, training of staff, supervision and coordination, community involvement, strong management and leadership are essential in this step. Step 7, monitoring. Are we doing it right? Monitoring ensure activity are being implemented as planned. For example, number of OPD session held, OPD attendance, stock availability. Step 8, evaluation. To see did we achieve our goals. Evaluation assess through outcome and impact, effectiveness, efficiency, equity of the plan. Evaluation result provide feedback for next planning cycle. Challenges in PHC planning. Challenges are inadequate funding, weak data system, shortage of trained human resources, political interference, poor intersectoral coordination, urban and rural disparities. Future direction in PHC planning. Future direction in PHC planning are digital health and AI supported decision making, climate resilient PHC system, stronger focus on NCDs, community led micro planning, integration of PHC with UHC framework. Next topic is universal health coverage. Universal health coverage means that all people receive the health service they needed, like promotion, prevention, treatment, rehabilitation, palliation, without suffering financial hardship. UHC cannot be achieved without strong PHC system. WHO emphasized that UHC is built on strong PHC system. Next is comparison between primary health care versus universal health coverage. This is a table of comparison. First is definition. In primary health coverage is comprehensive community-based approach to healthcare, whereas universal health coverage ensure that all people get needed health service without financial hardship. Nature PHC strategy approach for organizing health service. In UHC goal outcome of health system. In PHC, main focus is prevention, promotion, community empowerment, whereas in UHC, assess coverage and financial protection. Level of care in PHC, mainly primary health level with referral system. In UHC, all levels, primary, secondary, and tertiary. Community role. In PHC, active participation in planning and implementation. In UHC, mainly as a service user. Financing. In PHC, government-funded low-cost intervention. In UHC, relies on health financing mechanism, insurance, taxation, pool financing. In PHC, equity focus on underserved population. UHC, coverage for entire population. Relationship PHC means to achieve UHC and UHC achieved through the stronger PHC. PHC and artificial intelligence. How use of AI strengthen the primary health care through early diagnosis and screening. AI enable early detection of disease at primary level through analysis of symptom images and test result. For example, AI assisted screening for diabetes, hypertension, tuberculosis, AI-based cervical and breast cancer screening, automated interpretation of basic laboratory result. Impact of this is early detection, reduce complication and referral burden. Second is clinical decision support at PHC level. AI-powered clinical decision support system assisted primary care provided by suggest possible diagnosis, flagging danger sign, recommending evidence-based treatment protocol. Number third is strengthening preventive and promotive care. AI analyze population data to identify high-risk group, predict disease outbreak, guide targeted health education intervention. Number four is support to community health worker. AI enable mobile application support community health worker, for example, lady health worker by providing decision support during home visit, risk stratification of mother and child, improving reporting and follow-up. Telemedicine and digital health integration, AI enhanced primary health care through automatic patient triage, chatbot for basic health advice, follow-up reminder for chronic disease management. Number six is monitoring and evaluation and surveillance. AI improves disease surveillance system, early outbreak detection, monitoring of PHC program performance. Next is PHC and AI in Pakistan. Pakistan, AI can support overburden BHUs and RHCs, strengthen the lady health worker program, improve maternal and child health outcome, enhance control of TB, hepatitis, dengue, and NCDs, reduce urban and rural health disparities. Challenges in applying AI to PHC, limited digital infrastructure, poor data quality and availability, ethical and privacy concern, need for training of health workers, risk of digital divide. Next is MCQs. MCQs number one. A district health officer find the maternal mortality in one facility due to poor antenatal care coverage. Before designing intervention, she review demographic data, disease pattern, service coverage, and community perception. This step of PHC planning is known as A. Priority setting, B. Strategy formulation, C. Situation analysis, D. Monitoring, E. Evaluation.
A.
C is the right option. In which reviewing the demographic data, disease pattern, service coverage, and community perception. So this is the first step, situation analysis. MCQ number second, a country expand health insurance to cover secondary and tertiary care while simultaneously strengthening BHUs to reduce unnecessary hospital referral. This strategy best reflects A. PHC replacing UHC, B. UHC independent of PHC, C. PHC as the foundation of UHC, D. UHC limited to hospital, E. PHC focus only on curative care. C is the right option, PHC as the foundation of UHC. MCQ number 3. Which of the following scenario best represent universal health coverage rather than primary health care? A. Community participation in health planning. B. Strengthening referral from BHUs to hospital. C. Free access to comprehensive health service without financial hardship. D. Use of appropriate technology at community level. E. Home visit by community health worker.
B.
C is the right option. Free access to comprehensive health service without financial hardship. MCQ number 4. At the end of a three-year district plan, immunization coverage and child mortality rate are assessed to determine whether triage are achieved. This step of planning cycle is A. Monitoring, B. Situation analysis, C. Strategy formulation, D. Evaluation, E. Implementation.
D.
Yes, D is the right option. MCQ number 5. A policymaker stated that improving preventive service at PHC level will reduce catastrophic health expenditure at national level. This statement best reflects which hardship. Primary health care and universal health care are unrelated. B. PHC weaks UHC. C. UHC replace PHC. D. Stronger PHC support achievement of UHC. E. PHC focus only on tertiary care.
D.
Yes, D is the right option. MCQs number 6. A district revised its health plan after finding their maternal mortality target were not achieved in previous cycle. This section demonstrates A. Evaluation feeding into replanning. B. Monitoring only. C. Priority setting. D. Strategy formulation. E. Resource mobilization.
A.
Yes, A is the right option. MCQ number 7. Which of the following best differentiate PHC from UHC in practice? A. PHC is policy oriented, whereas UHC is community based. B. PHC focus on service delivery. UHC focus on access and financial protection. C. PHC cover tertiary care. UHC cover primary care. D. PHC eliminates out of pocket expenditure completely. E. UHC ignore prevention.
B.
B.
Yes, B is the right option. PHC focus on service delivery, whereas UHC focus on assets and financial protection. MCQ number 8. Artificial intelligence in PHC is mainly used for A. Improving health policy governance. B. Early diagnosis, risk prediction, and personalized care. C. Recruiting health staff. D. Ensuring healthcare financing. E. Hospital constructed plan. B is the right
B.
option. Yes, B is the right option. Early diagnosis, risk prediction, and personalized care. MCQ number 9. Which evaluation findings provide the strongest evidence that PHC planning was successful? A. Increased budget utilization. B. Increased OPD attendance. C. Improved health outcome with reduced financial hardship. D. More trained staff.
C.
C.
Yes, C is the right option. MCQs number 10. Which of the following scenario best represent universal health coverage rather than primary health care? A. Community participation in health planning. B. Strengthening referral from BHUs to hospital. C. Free access to comprehensive health service without financial hardship. D. Which of the use of appropriate technology at community level? E. Home visit by community health workers.
C.
Yes, C is the right option. This is key to the MCQs. Thank you.